Thank you. May I remind members that they should bob if they wish to speak in this debate. This debate will run till about 3:10, and I'm intending to call the Liberal Democrat spokesperson at 2:38. I call Dr. Scott. Oh, the question is that this House has considered the impact of NHS workforce levels on cancer patients. I call Dr. Scott.
Thank you, Ms Hobhouse. You won't be surprised to hear that it's a pleasure to serve under you today. And I do also have to thank the member for Wokingham for bringing this debate, and it is a really important subject. I will start by declaring an interest. My lovely wife has actually worked as part of the NHS workforce in Scotland for around 30 years now, and on Monday she's due to start a one-year secondment to the Marie Curie Hospice in Edinburgh, so I will take this opportunity to wish her well. And it's also a good opportunity, since it looks like I've got a little bit more time than expected, it's also an opportunity for me to thank all the people in Edinburgh South West who do raise money for that hospice, including Bobcat Alpacas, who recently raised around £10,000 at their open day. And also this morning I met with Macmillan Cancer Support. I'm sure others here did so as well, so I do want to recognise all their efforts right across the UK in supporting people facing a diagnosis, and also groups in my constituency like the House of Hope, who support people with breast cancer diagnosis. But I think we do have to recognise that the pressure that NHS staff are under, not just my lovely wife, but staff right across the NHS in the UK, but I will start talking about England, of course. And it's that pressure for those staff who are supporting cancer patients in the NHS, which is why I absolutely welcome the forthcoming workforce plan and also the National Cancer Strategy. And I hope these can make a real difference to staff and cancer patients in England. And I'm proud it's the Labour government that's showing real ambition, and I think that ambition word is really important on this. But I do support Cancer Research UK's ask for a dedicated cancer workforce planning strategy. And I agree with Leukemia UK when they say the 10-year workforce plan must enable and support the delivery of the National Cancer Plan. I'm sure that's not a controversial view at all. It makes absolute sense. So I've been really lucky in that I've been able to table a private member's bill on rare cancers, and through that I've met many cancer charities. And I have to say, all of them actually respect the work of the member for Wokingham. I'm trying to find one that doesn't, but they all absolutely do. And I recently met with Blood Cancer UK to talk about their work, and it was them that informed me about this debate, actually. But they asked me to raise the situation in haematology in England as being particularly concerning. Blood cancer accounts for a third of cancer deaths in the UK, but they say treatment is continuously impacted by staffing shortages. They told me how one patient shared that in the last 5 years they had 7 different consultants, and they were terrified about not knowing who to contact if their symptoms got worse. So not a great situation for that person. Figures from Blood Cancer UK show that in the south east of England, the vacancies for advanced haematologist nurse practitioner roles are 111% greater than those in posts. So there's more vacancies than there is people in post. So that is impacting both on patients and for the staff who are on post. It must be in post. It must be incredibly stressful for them. So I do hope that the upcoming workforce plan, in it, the government recognises the central role haematologists play in cancer care. And we have to recognise that having a haematology workforce which is staffed to the correct level has benefits well beyond cancer care. And I do hope the government will put in place measures to address these shortfalls. And I think, as I think the member for Wokingham touched on, I think steps to drive up recruitment and retention of clinical nurses will be crucial. And Chair, I will now speak a little about Scotland, where health has devolved, of course. Back in August, I welcomed the news that the risk of dying from cancer in Scotland has reached a record low. And I think that's a fantastic landmark. However, that data only covered us up to 2022. In 2025, we know that cancer waiting times in Scotland have never been worse, The Royal College of Radiologists have indicated that without addressing staffing, the situation is only going to get even worse. And that, right now, that seems unthinkable. Data shows that there's a 25% shortage of radiologists. Again, I think a discipline which has benefits well beyond just cancer care, and a 19% shortage in oncologists. Looking again at haematologists in Scotland, 1 in 5 consultants are nearing retirement, and there's currently low recruitment into that sector, so patient groups are very concerned about what that means for the future. The Scottish Government, of course, says it's investing in cancer treatment, yet patients are being failed and left without effective care. That's the reality when you look beyond press releases. And you don't have to just take my word for it, Chair. Dr Ian Kennedy, who chairs the British Medical Association in Scotland, said that Scotland is now divided. It's split between people who can afford to go private and those forced to languish, that was his word, on NHS waiting lists. So often we think about people going private for cosmetic works or perhaps even a hip surgery, but going private for cancer care, that is a real inequality if that is what's happening in Scotland or anywhere, actually. Indeed, cancer mortality rates for the poorest in Scotland are 78% higher than the richest, which should shame me. It shames me as a Scot reporting that, although I do want change. So the Scottish Government is failing to address the very low staffing levels that feed these issues. Currently, there is no workforce plan. The UK Government is currently looking at one, but there's none in Scotland. They actually had one. It expired in March this year, and I checked it this morning. It did not even mention cancer care. So perhaps that's why we've got the worst cancer waiting times on record when we had a workforce plan that did not even reference cancer. So whilst the UK Government is taking action through the workforce plan, and I look forward to hearing more about it from the Minister in the summing up, the situation in Scotland, I'm afraid, looks like it can only get worse. And I do hope that we'll have an election next year in Scotland for the Holyrood Parliament, and I do hope that cancer care is a key part of the discussion we're having, because it is a real crisis in Scotland, and the country really needs change. Our NHS needs change. Thank you, Chair.